Okay, guys, I'm going to start wrapping up the breakout sessions, and I'd like to invite a person from each of the breakout sessions to come up and summarize their findings for me. I will do the healthcare education breakout. We had a brief but very interesting discussion, and for details, we've actually posted our paper up. You can come and read it. But just to summarize, I think several of the survivors indicated it would have been nice if they were correctly diagnosed to, at the time of discharge, have a FAQ or frequently answered questions sheet or information sheet that they could take home, to have a mechanism to check that they've processed the information that was delivered to them, and perhaps to bring a person with themselves to the follow-up visit that they would have with their provider to take notes and ask questions. There were several discussions about how to best address expertise with the provider. And one of the thoughts was, instead of asking the provider, do you know about this, is just to say, who do you know that has expertise in this? And where can I go for more information? We also talked about potentially having an online system where people could go in a searchable, well-managed forum that people could get information about FAQs. And then we also briefly touched on having almost a big brother or buddy system with a mentor who's also gone through the process with them. So those were some of the brief overviews. Obviously, there's a lot of work to be done in developing a healthcare education toolkit. But I'm going to step down and have Esther come up and talk about her sub breakout.
So our working group was looking at what are the research questions and how do we get it done. And I'll just go through some of the major ones. The first one we talked about was hormones, and the specific questions were, what is the relationship with hormones with SCAD, hormones with chest pain? What about SCAD and its relationship with hormonal changes over the lifetime? Influences of multiple pregnancies, oral contraceptive pills, hormone replacement therapy, fertility, menopause, etc. And what about the hormone relationship in men? And then we had questions about chest pain. Why? So people have it, we know it's common, but what is the cause of the chest pain? Could it be related to other symptoms such as migraines? So when the migraines are flaring, does the chest pain flare? Is that a pattern? Do they occur more when you're otherwise ill with fever, flu, etc.? I.e., what are there non-hormonal aspects that go along with chest pain as well? In terms of recurrence, what are the factors that are associated with recurrence? For instance, if you have FMD or not, if you are over 60 or under 60, if you have blue eyes or brown eyes, etc. So breaking them down into subsets. And then we talked about various possible predictors for SCAD. For instance, could there be blood that is collected and stored so that eventually we'll have a biomarker or a test that is specific for SCAD? And are there also other predictors for SCAD on angiogram or on other kinds of tests that could predict whether a person would have SCAD or not in the future? We talked about what is the best diagnostic method for diagnosis of FMD and other arterial diseases outside of the coronaries. We talked about various funding mechanisms that we could pursue, the NIH funding mechanism, industry funding mechanisms, and also patient-driven philanthropic work as well. And then finally, we ended up on a note of how do we best pursue the research, and really we decided that collaboration is key amongst doctors, but also amongst patients to erase competitions and politics. So that's the summary.
Hello, everyone. So our breakout group was about advocacy. We talked about what are people doing now in terms of advocating for SCAD in general. So not specifically like advocating for yourself as a patient, but advocating for SCAD and more research and awareness and education. So what are folks doing now, and what would you like to do in the future? So if money was no object or those types of things, ideally, what would you like to be doing in the future? And so in terms of things that people are doing now, a lot of hospitals, including Stanford, have patient and family advocacy councils. And so a couple of folks in our group were participating in those. Also, people are distributing at their centers SCAD-related brochures and forms and things of that nature. So even if you don't have a formal council at your hospital or your clinic, you can still put out materials about SCAD, like in a women's heart health clinic or in a general heart health clinic. Also, a lot of people are just doing more that one-on-one type of education and awareness of educating your friends and your family. Also at your workplaces, a lot of companies have wellness programs where you could volunteer to be a speaker and talk about SCAD and heart health. And so many times when you approach those types of situations as saying that you want to talk about overall wellness and heart health, that will be more well received versus saying I want to focus in on SCAD, but you can use that as a platform then to also speak about SCAD. We also have, I know, a lot of folks who are starting to set up support groups in their local communities and using social media to gather folks for that. We've also heard about a couple of nonprofits who are advocating specifically for SCAD, and so you can support those nonprofits like SCAD Alliance and others through helping them man booths at things like the conferences like ACC and whatnot, or through fundraising. And then the advocating specifically for SCAD-specific cardiac rehabilitation. So we heard a lot about that today, the importance of just doing cardiac rehab in general, but also making sure that it's focused for SCAD-specific patients, and that your insurance companies cover that. So advocating for that with your insurance companies and even in your legislatures, that's something that should be covered. Then in terms of some of the other future items that we talked about, dedicating your volunteer time that maybe you previously have been dedicating to other things, if this is a new cause, whether you wanted it to be or not, that is now near and dear to your heart, shifting that time to volunteer and focus on SCAD-related items. Another thing that we talked about that you'll see at a lot of cancer centers is they have what I call treating the whole patient. So when you come in for, in cancer situations, you come in for your IVs and different things that you have to do on almost a regular basis. They will also have massage therapists there at clinic, and they'll have a knitting time, and they'll have a yoga time, and different things of that nature. And so really building out programs, SCAD programs that treat the whole patient and not just the clinical aspects. And then finally, the American Heart Association. We all know that they have the Go Red for Women movement and things of that nature, and making sure that we try to get our SCAD voice as a key part of that movement, because they do have that broad-based funding already, and trying to get them to focus that funding there.